The reason I got into healthcare is I had spent some time in government working for the governor of Massachusetts and saw how important healthcare was to people, to the economy, and to the whole kind of ecosystem in Massachusetts. One of the most important issues we were dealing with is the high percentage of people who were left out of the healthcare system. 40 million people in the nation, 500,000 here in Massachusetts. I really wanted to make a difference and see, could we bring health insurance to everyone? The Blue Cross plan here has played a major leadership role in a couple big movements that have had an impact here and nationally. We started the work that led to the passage in Massachusetts in 2006 of the first ever universal healthcare law for a state. That in turn led to the passage of the Affordable Care Act nationally. And the Blue Cross plan played a central role in leading our community to pass a law here in Massachusetts. We immediately turned our attention to the question of affordability. And central to that, the biggest way that we as a plan could influence affordability was to change the way we pay for care. We started with a few kind of pioneering physician practices in Massachusetts, and it quickly became the largest payment reform initiative in the nation. Like everywhere, the Blue Cross Blue Shield brand means security, peace of mind, stability, and trust. I think additionally in Massachusetts, it means a commitment to community. We have two major initiatives involved in community service. The first is our independent foundation that is a grant-making organization that supports low-income health and vulnerable populations in the state. We also have a very comprehensive corporate citizenship program which involves volunteerism, service to the community, and deep partnerships with local not-for-profits. There is an opioid crisis across the country and a pretty serious one here in Massachusetts. Before this crisis was even kind of well known and written about and broadcast on TV, we began a special project to try to do something about it. So we gathered together a group of experts in addiction medicine, pain management, primary care, and we said, what can we do as a plan to try to solve this opioid crisis? And what we did is we changed a lot of our rules so that if you were going to get a long-acting opioid, you had to try a short one first. And if you get a short-acting opioid, there'd be a limited number of prescriptions you could get. Those simple two acts resulted in 21 million fewer doses of opioids in Massachusetts over a several-year period. It's been a model program. The Centers for Disease Control evaluated it and said this is a model program for the country. One of the toughest areas in healthcare is care for serious illness and at the end of life. Within a very short period of time, I sadly lost my father, my mother, and my brother to chronic illnesses. But it was still a kind of beautiful and meaningful experience because each of them were able to express their beliefs and preferences for how they wanted their care delivered at the end of life. And I said to our team, what can we do as Blue Cross to give our members the kind of experience my family had? We've designed a program that helps our members express their values, beliefs, and preferences for the kind of care they want at the end of life, and then encourages physicians and hospitals to meet those needs. The healthcare system remains expensive, fragmented, hard for patients to understand. We need to reinvent it. We need to make it simpler, easier, and focused on results, and the results that patients want.